present, okay?
Manai, no
I'm
problem.
sorry, Manai. Yes, Manai. Yes,
Real
I
pronunciation.
truly
Thank
apologize.
you.
Manai, I apologize. We are now live on YouTube. If you could please add your community board or your agency in front of your name, please do so now.
We are live on the website.
All righty. Good morning, everyone. I want to thank all of our district managers and staff who are on the call today. This morning, we are pleased to be joined by Manai Tafari. Got that right. Manai is a senior staff attorney at Queens Defenders and is also the co-founder of the Queens Defenders Justice 456 program. As many of you know, on January 25th, our office was pleased to partner with Queens Defenders for a Cannabis Take Action webinar. The webinar was a success as we discussed the marijuana regulations, the Taxation Act, and the expungement of marijuana-related criminal records. This morning, Manai will present a brief history of cannabis in the USA and the reasons behind stigmatizing the plant. Very interesting, by the way. I just was watching a Netflix series on this. Manai will also explain how this stigma has been broken down in ways that the MRTA can continue to process. Thank you for joining us today, Manai. The floor is yours. And unmute.
Thank you very much, BP. And before I begin, I just want to say what a great pleasure it is for me to be here, to be in front of you guys and presenting. I think when you're in government, it's such an important task. And when I speak with high schoolers and they tell me they want to be in government, I'm inspired because this is a job where you take the slings, you take the bows, and people have a lot of complaints, but this is where the work gets done. And what we're going to discuss today, the MRTA or MRTA, as I like to call it, was implemented because of guys like you, because of people in government who understand that things needed to change. And it is my belief that a few things have changed to make kids in high school now want to be sitting in your seats because they're seeing that their lives are being affected. Between less is more, bail reform, and what we're going to discuss today, marijuana reform, these children are now looking and saying the people in our government are making our lives better, which is what government is supposed to do. So to go ahead with the presentation real quickly, I'm going to try to share the screen. And what we're going to do is discuss marijuana in the US. And we're going to start first discussing a history of the plant. And we're going to start with marijuana or cannabis in the US before there was a United States of America. Now,
Manai, can you just enlarge your screen, please, so that it's in presentation mode? At the bottom right corner, you'll see the plus and minus sign.
No
to
problem.
To the left of the minus sign, you'll click that button. In the bottom right corner. Yep, wait, nope, wait, go to the minus sign. Yep, to the left of the minus sign, you'll see a button. Yes.
There we go.
That. Thank you. There you go. Awesome.
Okay, so pre-USA, which would be colonial America, before USA was founded, the US had hemp and marijuana production, and it was strongly encouraged. We're talking about early English USA, basically, prior to when we became a country. Now, early American farmers also produced the cannabis plant after the Revolutionary War with England in 1776, and we actually became a country. Cannabis production was normalized in America, and farmers did make money. Now we're just going to go a little bit forward in history, and cannabis was actually flourishing. This would be after the Civil War, as we know, after the 1860 period, 1870s. This is a way where people made money, and hemp was widely used in the production of rope, sails, and clothing. Here we see a dated classic picture of a hemp farmer. Not only was hemp used in manufacturing goods, but people understood that cannabis had the power to cure. And we're going to get to that at the end of this presentation. But we understood that cannabis was beneficial medicinally way back. So here you have cannabis, I believe it was indica, and it was being prescribed and used and sold openly. Now, this is the Mexican Revolution, and this happened south of the border. And when this happened, many other historical things began to take place. After the war, there was a whole lot of migration south, and people from south of the border began to come in. Now, when the Mexicans began to migrate, they were a convenient scapegoat to many people, unfortunately, during this time. The Mexicans who immigrated were sometimes scapegoated. There was a strong anti-immigrant fervor, unfortunately, back then. And people were saying things about the marijuana menace that was starting to invade the country, almost substituting the plant for the people they did not want to see enter the country. Now we're going chronologically here, taking a little bit of a step forward. And here is the Great Depression. As many of us know, the Great Depression started late 20s, and it continues basically through the 30s until the FDR administration came in with the Second World War. However, during the Great Depression, we started to see marijuana stigmatization stepping up in the eyes of the public. So here we see a sign of during the Depression. It says here, jobless, keep going. And underneath, I think it's a little bit cut off, but it says, we can't take care of our own. So the Great Depression accelerated this anti-immigrant, anti-marijuana campaign that was starting to go strong throughout the country. Now, continued fear and resentment of Mexican immigrants led to government efforts to make the plant illegal. Now, prior to the 1930s, there was no issue necessarily legally with marijuana, but by 1931, marijuana had become outlawed in 29 states. Federally, it was still legal, but states little by little, almost the reverse of what we see taking place today, where little by little the states are going the legalization route. Back then in the 1930s, we had the opposite starting to take place. Additionally, we also saw a stepped up campaign of stigmatization. You see here, this devil's harvest, the things they said about the plant, degradation, vice, insanity. So Hollywood began to also step up their efforts. And in the psyche of the public, marijuana was slowly going from something that had use medicinally to something that was starting to be stigmatized. Now, we go to 1937, and this is when the plant becomes illegal in the US, meaning federally illegal. The picture that you're looking at is a man named Pierre Du Pont. Now, Pierre Du Pont, if you knew nothing about him, when you hear the name Pierre Du Pont, you know that he's a man of means. Now, Mr. Pierre Du Pont was the president of the DuPont company. DuPont, he was president between 1919 and 1921. He served on the board of DuPont until 1940. The reason why I mention this is because DuPont was responsible for making a product called nylon right around the turn of 1930. Now, nylon had competition from cannabis, because with the cannabis plant, it was textiles, paper, rope, and animal bedding, things that nylon was also making. What the DuPonts did with their corporate power, and DuPont also became the president of GM as well, General Motors. DuPont with their corporate power helped the stigmatization of marijuana and encouraged it. They also pushed marijuana being stigmatized in the public, not through any great reason, but because it was competition for the product that they were pushing, which was nylon and other textiles. Moving forward to the Second World War. And even though marijuana was being stigmatized within the country and within the psyche of the country, those in the know and those who knew what things were important, being the military, understood that you could use this plant for really beneficial reasons. Therefore, there was a patriotic plan for a patriotic plant. And there was a program during the Second World War. The US military launched a Hemp for Victory campaign. And in this Hemp for Victory campaign, we had 375,000 acres of hemp in the United States. And what this did was it produced parachutes and other important military gear for our nation. So although the plant was being stigmatized, the plant itself was being used to help the nation in the most important thing the nation can be helped with, which is service. Now, where government is concerned and where laws are concerned, federal laws started to have mandated sentences for drug use overall, and specifically marijuana. This, along with the stepped up stigmatization that was happening, really created a problem. Now, not only was marijuana illegal, but now you also face consequences, meaning jail time and other penalties for marijuana. As I stated, this will be chronological. Here, I must admit, these are two presidents who I consider to be really great men. This is where we get into the alphabet portion of the presentation. We have LBJ and JFK here. As many of you know, LBJ and JFK, they competed for the 1960 nomination for president. Nixon also competed in that presidential election. So we got three presidents from one election. But moving right along, LBJ and JFK commissioned a study to see whether or not marijuana led violence. In 1972, the Schaefer Commission recommended that marijuana should be decriminalized for personal use. This is on a federal level. These are two presidents who decided we need to study this to see what are the benefits in criminalizing a plant versus decriminalizing a plant. And the Schaefer Commission came out, it's something we could research, and it stated that it recommended decriminalizing the plant for personal use. This was in 1972. Now, President Nixon nixes the proposal. As many of you know, LBJ became president after JFK, and President Nixon became president after LBJ left office. Now, President Nixon nixed the proposal because President Nixon had very different views politically about marijuana than the other two presidents. Now, looking at it objectively and looking at the Schaefer Commission objectively, it stated that decriminalization of marijuana should be done. However, President Nixon decided no. Now we're moving right along to an era where many of us are a little bit more familiar with. We're getting up to the 80s now, and it brought us a new president, former governor of California, and there was a whole new view of marijuana at this time. Now, overall, during this era, there was a big Just Say No campaign, and marijuana was no exception. The president's wife, Nancy Reagan, led this campaign. It was to get kids off drugs, specifically hard drugs. However, marijuana was no exception. And it was stated that marijuana was a gateway drug. So cannabis was seen, therefore, as not different than much harder drugs, especially on the federal level, which then trickled down, if you will, to the states. But it also said that marijuana could start a really bad drug habit, so it was not treated any differently. This also had a really a negative impact on many Black and minority people, because in the legal system, there was a 3 strikes, you're out, and mandatory sentences, again in the 80s, for marijuana. So therefore, you would have somebody who would have 3 convictions. 2 of them might be for a marijuana or drug possession. That third one might be for something more serious, or vice versa. But once you had that 3 strikes, you're out. And there are many people who simply for possession of the plant added to their criminal record, and they got harsh sentences. Even here in New York, what you would have was people getting convicted for marijuana possession, then they became what's called a predicate. And then if they committed any other felony, then their sentences would be seriously impacted with a whole lot more jail time. Moving right along chronologically, we see a brighter day coming here. With Proposition 215, this was 1996, over on the West Coast in California. Proposition 215 in 1996 allowed AIDS patients or people suffering from HIV to have legal access to the plant. So we're coming now back from just after the colonial era where we were using marijuana for medicine. We learned that we can still use marijuana for medicine. And a new day started to come with Proposition 215. One of my favorite artists, and I'm sure some of yours as well, saying a change is gonna come. So this is what happened after Proposition 215. A change actually did come. And the reason why the change came was because of government people like you. It was because of people who were pushing very hard. We see here Ms. Stokes, Mr. Saunders, and Queens representative, actually. And these are the people who push the reforms forward, making MRTA possible. And with MRTA possible, not only are we going to have less jail sentences, but we're also going to have a destigmatization of the plant, which is very, very necessary. We did this in a chronological way. And just to wrap up, I like to make the point that history is not always one that progresses. We used to have 2,000 years ago, Roman Empire. They had aqueducts all over the place. It was an evolved society. And then we had the Dark Ages 1,000 years later. And when that happened, people were looking for water in wells miles and miles away. So what we have is people understood the benefits of marijuana, but we regressed. And it's going to take government officials, politicians like you, to understand that we should not regress, we should continue to progress. And if we do that and destigmatize the plant, that's where we're going to understand that kids can have a different view of it. Constituents could understand that this is a business opportunity. This is something that can help with their health. They can get prescriptions, and we can take the stigmatization away, because that's what's been hurting many people in Queens. So I thank you guys very much for listening to this. I hope it was not too long, and I really, really appreciate it. And I'm willing and ready to answer any questions.
Cool, and we'll go to questions in a second. And I definitely, and you could unshare your screen now. So I want to thank you, Manai, for that presentation. And I also have to credit the city council first in getting this rock up the hill, because a lot of people forget about the work we did in 2016. I was the chair of the Public Safety Committee. Danique Miller and I had uncovered that majority of all summonses and arrests around marijuana were in the 105th precinct in Southeast Queens, over 10,000 summonses and arrests. And my committee at that time uncovered it, and it sort of opened this public dialogue in which the mayor was asked to explain. Then Police Commissioner O'Neill was asked to explain why these summonses were so heavily centered in Southeast Queens. And at that time, Police Commissioner O'Neill alluded to the fact that 911 reports and 311 complaints were the impetus on why the 105th, for instance, led the city. for over a decade. But then when we looked at the data, or the 311 and 911 data, we actually uncovered that more of the complaints were coming from Northern Queens than Southern Queens. So, so one of the things, and we know that the geography here, we know that this is a Black middle-class neighborhood. You relatively don't see people walking up and down the block smoking weed. I mean, there's like one person on my block, me and Marie share a block. I see one person, and I know who she is. She keeps it moving.
On my block.
No, she doesn't live on our block, but she walks through our block. It is pretty common. But probably that's the only person I've seen since I've lived over here. But for some reason, all the summonses and arrests were centered here. So it felt like if you were going to make that correlation between 311 and 911 data, it didn't match up, right? So really, as we talk about now disparities in the legalization, as Manai touched on, one of the things we want to ensure is that, and those numbers did drop, because I think we were at like 20,000. When I left the council, we were somewhere around 300 or 400 arrests and summonses, but there still were disparities even there. Before that, 92% of all summonses and arrests were of Black and brown people, although we know, if you look at the data, everybody smokes marijuana. Not everybody, I don't smoke, but based on it's not one class or one color of people who smokes marijuana. White, Black, Asian, everybody smokes. But yet, Black and brown communities were overly targeted over this. So I'm very happy that the state is correcting this, because you got to think about also the impacts on young people who are actually being arrested outside of these high schools as well for just having low. I'm not talking about a whole bunch of ounces, but just a bag of marijuana, and the impact on them for the rest of their life. Once you have that arrest on your record, it follows you, cuts you off from, college scholarships, right? You can't get that federal grant or state grant, housing, job opportunities, right? So there's this boomerang effect when you talk about this issue, and I definitely have to applaud my state electeds who really understood. And it's a complex issue because nobody wants to smell smoke. We know people are going to complain about that, but at the end of the day, you can't criminalize somebody for the rest of their life over low level marijuana. I mean, people shouldn't be in jail for their entire life, technically, because they're doing a life sentence over low level marijuana. So I just wanted to add my 2 cents there, because I've done an extensive amount of work on this, and to see the rock get pushed up the hill was really a historic moment for communities that are hit hard. And then I'll end in just saying that this is going to be $1 billion industry. We know. And one of the things we're stressing, and I've looked at what they've done in Oakland, for instance, we need to make sure that the communities that were most impacted are the communities who benefit the most as well. And I think there was a report that came out yesterday in New Jersey, I think, Manai. I think I saw a report on how relatively all the new contracts delved out for marijuana licenses did not go to, out of 57 licenses, only one went to a Black or brown person. So we want to make sure that there's equity even as this happens, and that the communities that were hit hardest are the ones who benefit the most. As I say, these communities are not just looking for contact, they're looking for contracts and ownership. So we want to make sure that those things are happening as well. And I don't smoke. I have not inhaled since high school. But the point is we need to make sure that we level the playing field here. So we'll go to questions, because there are going to be a lot of questions in community boards. One of the things that I focused on even before I left the council, and we're going to sort of start to think about a task force in this area, was this process going through somewhat of a ULEP process, because we also don't want certain communities having all the smoke shops in them either, or, right? So we want to make sure that, it's spread out, and that, there's no one community that has too much. So this may, as we play out this process, somewhat enter into a ULEP process. And that's something that, I certainly want to see. It's one of the reasons we want a municipal control over the conversation as well, so we can dictate some of those terms. So I know those will be some challenges that boards raise, and I just want you to know that we're working towards that. We are going to have a Queens task force on this. So if anybody's interested, you should definitely reach out to the office as well. All right, with that being said, any questions? Frank, you got any questions? I was messing with him.
Yes, now we do. Thank you. Thank you. That was very informative. Excellent history, by the way. I'm a history buff, so I really did appreciate that. And that's something we should be teaching the kids in school. We've got to educate the next generation. I'm okay with what's going on today, and we're moving forward. That's great. But Borough President, I didn't understand when you say municipal control, because the state hasn't come down to us to say, these are the regulations. How long do we have to wait? There's a lot of buzz and conversation going on, but I'd like to answer our constituents, the people on our boards, et cetera, of how these dispensaries are really going to work. Will it work like the state liquor authority, that it does come through us in a process? Will we have approval, non-approval? Are we simply advisory? Are they really going to listen to us like they don't listen to us regarding a liquor license? So, I mean, this is important stuff, and I think there has to be, there's not a question, but there has to be equity throughout. They shouldn't all be, say, for example, on Queens Boulevard. They should be spread out so that everybody can certainly take advantage of this new era that we're going into. And the reach out, and I'm going to go back to the school thing, because that's my thing. The reach out has to be the schools. I remember way back when I was a teacher, there was a book. It was called Drugs, Alcohol, and Me. It's in the connotation, drugs, let me go to the drugstore kind of thing. It can't be like that anymore. We've got to teach so that this next generation, your son, my grandsons, could certainly understand the plant, how it's used, and this darkness, this reefer. There was a movie way back when, Jonathan will probably remember it, Reefer Madness. I mean, come on, it's 2022. That's my 3 cents. Yeah, sorry.
Thanks. Yeah. So,
I'll cut out.
I guess Manai, you could. I mean, I do know the answer, but Manai, you're a specialist. Go ahead. You can answer that question.
Oh, I'll take a part of it, and you can take the part that but I just have to say I love history buffs and I love teachers. So what you're saying is right. You're one of my favorite people just because of that. I think you're right. We have to speak with the kids, and we have to speak with the people that they're around, because you can have two views. You could either think this is a good business opportunity, this is something that can help the community, or you can think marijuana is bad. But even if you think it's bad, the cure cannot be worse than the disease. And we cannot be locking up these high school kids and, like the BP is saying, giving them records so they can't go to college because you think it's bad. So even if you think marijuana is not a good thing, we have to end the stigma, and we have to explain to the children why the stigma needs to be ended.
And then in terms of now, the state was tasked with creating some sort of task force. So they're going to be coming down with recommendations. Former Assemblywoman Tremaine Wright is leading up this office, and we're in actually I have a call with her, but I do anticipate that the boards will have, as we do on most ULURP items, have an advisory role somewhat through this process, but that is still, a lot of things are still TBD until the task force wraps up their work. But I do anticipate it will play out like State Liquor Authority. I think they're creating a separate entity which will operate similar to State Liquor Authority. But we're still waiting for those, for the specific information on that.
Thanks.
No problem. All righty. I think Florence, we're going to you next. CB1.
Good morning, Borough President. Thank you for this meeting. So this is a very important topic, and we appreciate your presentation tonight. It was very thorough and very informative. My concern is, like Frank's, how are the community boards going to be involved? And I have an excellent relationship with my representative SLA, and when my board comes forward and says, listen, we have 389 restaurants in the street and we're having a problem with this one serving alcohol, they do listen. And I'm hoping when marijuana is legalized, we're going to have the same kind of an effect, that they will listen. My concern is the future sales and service. So let's say in a perfect world, we have them spread out through the district and we have multiple shops in our area. Will there be public consumption in hookah bars? Will it be illegal to have a restaurant and serve food and smoke marijuana within the restaurant? Will there be some kind of a test for driving under the influence of marijuana the way there is for alcohol? How will we protect people from themselves, so to speak? What are the what guidelines will people be given? So, okay, this is a good thing. I agree wholeheartedly. No child should be disenfranchised because he had 2 joints in his pocket. Now he can't get, a student loan. That's absolutely sinful and ridiculous. But on the same token, we don't want that person to be 30 years old behind the wheel of a car and in an accident. So how do we take care of our community, and what are the safety valves that are going to be put into place? And also, how are we going to prevent impact on those who choose not to smoke?
Great questions. I think to start, as far as alcohol use, the consumption sites, I believe within the law, there can be no alcohol use within those consumption sites. So this fear of the marijuana going along with too much drinking, that shouldn't be an issue. Most restaurants, I believe, a lot of them do have alcohol license. Therefore, if it's a restaurant, I don't believe you would then have cannabis smoking going on in that restaurant.
And I don't know if I'm wrong on this, but I think back to the Bloomberg bill and also Gennaro bill. I don't know if smoking would be allowed inside of a restaurant anyway, because we had passed a local law on that. But just to be continued. Yeah, but do we ban smoking inside? You can't smoke inside a restaurant.
Yeah, correct.
New York City, right?
As to the DUI concern, and I think that is a very good concern, I think it should be a couple of steps. Again, that's my view. As a defense attorney, I see many DUI cases coming in over the last 13 years. And I think we have to break it down and first see what impact marijuana has when driving, and whether or not you could separate the impact that driving while smoking has, as opposed to people who drink. Now, if you're drinking and smoking, that's also going to impact you with a DUI. So there are breathalyzers for that. As far as testing for marijuana, I do not believe currently there is one. People have been researching this issue, I believe, much more over the last 2 years, but there's not a specific test for that. And I think it's just important for us to use science here and see what impact marijuana use has without alcohol, and then move forward.
And there are companies, I know during my time in the council, there was a company that came, and I can't remember from what country, but they had flown in because of some of the work we were doing around this. And there are companies looking to create some sort of technologies. Now, I can't speak to if those technologies are 100% accurate, but I could see some sort of technology evolving. And part of this was because of the response of the department, which had the police department, which at that time, Commissioner O'Neill had concerns of, folks smoking and driving and certainly being under the influence. So that technology, I think, eventually will evolve. And I think that company felt like they had hit, a point where they could go to the department to talk about it, but the science is still out, science still needs to be out there on it. And I'm sure we'll see some of those companies coming forward. Once again, we just have to see how accurate it is in detecting marijuana. Yeah. All right, we're going to go to Mark and then Marie.
Good morning, everybody. I think it would be helpful if we had some sort of information website brochure that explained exactly what's going on with marijuana right now. Is it decriminalized? Is it legal? What can you do? Where can you do it? Just so everybody's on the same page when we talk about what's going on. Borough President, you could maybe put on your website. We could share it on our websites. But I don't think everybody understands what the state has actually done. So that needs to be clarified, and it would be much appreciated.
Agree with you. And we're going to be doing, like I said, the task force is coming because as this fully blooms, as Frank said, as the buzz continues, we want to make sure that we're putting out that information to the public. So we did host a webinar, which is well attended last week. It was really good. Even I learned a lot off of it. But we anticipate a lot more public outreach on this issue as we move forward. And like I said, there are some things that still need to be determined, TBD, and we're sort of waiting for guidance from the state on some of those things. But we don't want to wait and be behind the 8 ball, if you get what I'm saying. So this is one of the reasons we're starting to have these conversations now, so that, by the time the state comes up with whatever they're going to come up with, we're at least well versed on the basics right now. And I don't know if Manai wants to add to that.
I just wanted to make sure that we all just had some clarity where we stand right now. I know there's going to be more worked out, but we need to understand what's going on right now so we can, we know how to talk to both our constituents, NYPD, and everybody else.
And marijuana is legal in New York State.
And Mark McMillan, I just want to thank you so much, Mark, because what you just said about speaking to constituents. I was born in 1979. Marijuana was decriminalized in New York since 1979. So if you had, I'm talking about before 2 years ago, if you had less than 25 grams, it was not criminal. It was only a violation. But because the people and the constituents did not know this, and there's a part of the law that says if it's in public view, it's a misdemeanor. So what would happen many times is police would ask young kids what they had in their pockets. They would say, I have this, and because now it's public, it's a misdemeanor. However, since 1979, it was decriminalized. So the education piece of it, and I'm glad what you guys are doing and the BP, what we're all doing, is so important for people on the street to understand, because it's that lack of education that's been hurting. Now, I know we're still in a holding pattern in a lot of ways as far as applications and licensing, but I think even to tell people what's happening now, who can have marijuana now, the fact that you can have 5 pounds of marijuana in your house without it being illegal now, I think people don't understand those things. You just cannot purchase. So that education piece, I think it's just brilliant, Mark.
Alrighty, thank you for that. And you could count on us to do that. And Kat Bresler, who I've assigned to my office to work on this issue, and Tarika Morrison as well, who does InterGov, are going to be reaching out to y'all. I think there is a website. I don't know if we could put it in the chat box now, and it has all of the specific information from now the Office of Cannabis Management, which is the state-run office, entity on this issue. All right, we'll go to Marie and then back to Florence.
Thank you, Manai. Knowledge is power. One thing last week, the Mr. Mainwright had a webinar and spoke about different things with the marijuana, cannabis. And she mentioned an incubator program that would help people, get the licenses and know what to do. Because the thing is, it's a good thing to have dinner at the table, but if you don't know that dinner is being served, you're not given a fork and a knife to eat the dinner, you're not gonna benefit. And I would like to know how they're gonna make sure that the people that do not know that dinner is served are given that knowledge. Because if we want to help those who are negatively affected by it for decades, we have to reach them. We have to let them know that this is an opportunity that is available to them. And I'm not sure how that's being done. Are they going to look to the records to see who had marijuana violations for them to reach out to them? Because I'm pretty sure if they had to reach out to someone who was formerly incarcerated, they would know how to do that. So how do we let them know that there is an opportunity? Because I understand that they're going to be, people who have been incarcerated or their immediate families are going to have, opportunities. But if they don't know these opportunities exist, then it's not really helping. So that's what I would like to see happen.
That's a great question. The people who've already paid the dues should be singing the blues. And there is a goal of having a 50% licensing for people who are minority-owned businesses or people who have been negatively impacted by what they call the marijuana prohibition. Now, the licenses are going to come in several forms. There's going to be licenses for cultivation. There's going to be transportation license, and there's going to be also micro business license. Now, for the people who you're talking about, the 50% goal, the issue is going to be access to land. And if you don't have land for production and cultivation, it's going to be a problem. So the incubators that they're going to start will help, but when you're at the front of the line, the people who will be at the front of the line and getting the license soonest are going to be the people who have means. It's going to be people, not necessarily the middle class or lower middle class or constituents. It's going to actually be the people who are already in the business from different states. And we need to make sure that whoever wants to benefit from the incubator has access. And it goes back to Mark's point, Marie. Your point is great. It's the education. And unless we can get to the people early, it's not going to work, because you already have some of the big boys. They're ready. They have their business plans going. They already have the location going. And the people who were impacted negatively by prohibition can end up getting left out, even though there's a 50% goal, because it's so hard to have that initial capital in order to make the necessary investment. And I think the education piece about the incubator, about the licenses that Macmillan mentioned, is where we're going to really have to go in order to avoid the people who pay the price from getting left out.
And let me just add to that. Let me add to that. And this is one of the reasons why Oakland's model, and I'm not saying it's perfect, was a model that I thought the state should study, because it mandated even the bigger companies to set aside space or give access to capital to those individuals who perhaps would not have the means to otherwise get their business up and going. So those things are still being determined. And I think, if I'm right, Manai, they are going to be targeting the communities who were hit the hardest are the communities who are supposed to see the biggest focus of outreach. And that's a conversation that I'm going to be having with Tremaine Wright, who's overseeing this office, in a few days or weeks, to start to have that conversation and center it specifically in Queens. We know Southern Queens, I'm sure there are portions of Western Queens, but those zip codes that really were hit the hardest should be the areas where we see the most outreach. And that's on us, right? I'm not leaving that up to the state. That's one of the reasons we're forming the task force early within the borough president's office, so that we can get ahead of it. But we're going to need each and every one of you as well to get this information out. If you're having community board meetings, if you can put this on your agenda to be talked about, when things are tightened up, it could be helpful in sort of, helping us get the word out. And like I said, we're going to be doing town halls upon town halls, community outreach events around this, having this office come out into the pockets of the borough specifically that were hit hardest is going to be on us, right? So, so that's the way I see it playing out. And I am starting to get we're getting outreach from people in the communities now already who are interested, because they see it's coming and they want to get ahead of it. I mean, we don't have enough information to give them yet until things are settled, but the peak interest is there, and I think, it's on us to make sure we get the information out. So I just wanted to throw that out there as well.
Board President, one thing that you are involved with, I think it has to do with land trust. And since Manai spoke about having land to cultivate, maybe that's something that the government can do, because it will be a land trust that still belongs to the government, but then the products and everything could be for that person who's being the cultivator, and then somehow share the profit. That's one way of making sure that person, a person who wouldn't be able to actually buy a land could have access to land to do cultivation. And I know that that's something that you worked on, Land Trust. So that's something that you
In
can bring to
community
the
gardens,
state.
that's a really good idea. I like that. I wrote that down. That's a good idea. How do we tie CLTs into this conversation? That's a good point. All righty, back to Florence and then to Debbie.
I have two separate questions. Thank you, Borough President. So when I mentioned somebody can have 5 pounds in the house, so people are now allowed to grow it on their own. That's legal. That's okay, correct? No?
So patients are allowed.
Say that again, please.
So patients are allowed to grow. So
Oh, with the prescription.
So medical marijuana has been around for years. However, you could have up to 3 ounces even now. You just cannot purchase it. So these are the little nuances within the law that people don't understand. So I can have 2 ounces of marijuana on me. That's totally legal, not illegal. However, you cannot sell marijuana. That is still illegal. So as far as the law is concerned, you could have a certain amount in your home even now. You just cannot sell it. You understand? So that's why marijuana is legal, and you could have a whole lot of marijuana in your home even today. But again, back to the point Mark was making and that I expounded upon, back in '79, marijuana was decriminalized. No one knew. Even today, the law is not clear. So even today, people with medical patients can grow marijuana, but everyone could have marijuana today legally, as long as you're over 18, obviously. But you can possess legally, you cannot sell legally.
Okay, understood. Now, my next question, Borough President, is Marie hit right on the nose with the land trusts. I didn't understand this during the pandemic. If we're legal in New York State, why are we going to bring marijuana from another state into New York State? Why aren't we making it homegrown and making sure that the people who have to have an opportunity should get the opportunity here? There must be ways around working around that, at least in the very beginning. It doesn't seem beneficial to legalize it and then have it coming from other states. I mean, should New York sell New York's own marijuana? And is it legal to bring it in from other states? It doesn't make sense. I mean, we shouldn't be buying.
I'll tell you this. I sat on a panel, Jesus, I'm forgetting this big law organization in Manhattan 3 years ago. And, this was a conference on legalization before the state legalized it. And when I tell you, there were people who flew in from around the country to be here. And I was astounded. I'm like, wow. It was like 200 people who were like interested, who do this in other states. And that is the conversation we're having with, this is partly why we're having these conversations, right? Because we don't want big business from out of state coming in and capitalizing off of this. So that's really the task of this new office created, to keep this homegrown. Now, I can't say that legally we can keep people from operating from out of state, but who's in control of the licensing, right? And that's key, right? It's very important that Tremaine Wright out of Brooklyn, whose community I'm sure was hit very hard by marijuana enforcement, also has a seat at the table on this as well, right? So she's leading this office. So that's the conversation we're going to have in a few days with her. And I want to hear a little bit more about what their strategy is on this, but they're going to be in control of the licensing. So that's key. That is key. And who gets those licenses is key. And how are we being transparent? And also just, one of the reasons this originally got knocked out was because the big companies wanted to come in, and they didn't want to give back money. Remember, this is a $1 billion industry. It's going to be money going into the state's coffers off of this. And, there were communities that, they were trying to shortchange us here, 500 million a year, whatever the number was at that time. And I'm very proud of our state elected officials who actually voted it down because they said not enough money was coming into the state to put back into the communities most impacted. So those are the conversations that halted legalization the first year And then, the past governor came back, and the legislature certainly forced him into a position at that time to get this right. So we'll have more money to put back into communities. So that's to be continued, but this is an early conversation.
Can I put in a request, money going back into the school systems?
Yep.
Please,
Yep.
and
education
500-foot rule with the schools and the churches.
Yep.
All right,
Yep.
thank
Yep.
you.
All righty. Debbie?
Good morning. Thank you.
We're on a roll this morning. No pun included. Go ahead.
Absolutely. Thank you very much for hosting. And we really appreciate the presentation. And as Frank said earlier, history lesson, that was, Benai, that was a great history lesson. We really appreciate it. I have like a two-part question, which bounces off Florence as well. We have, I guess, dispensaries now coming up to be regulated in this field. So how are we going to, are they going to come to the boards for advisory? They're just notifying the boards? Is it just for medical purposes? I also saw a newsreel that said that they were going to have like marijuana cafes. You can go pick out what you like, sit and enjoy like a Starbucks and have that. So are we going to be able to regulate that? State Liquor Authority does listen to us. We do stipulations. Is it going to be the same for this? And can we have some input?
I guess those are more questions directed at me. Debbie, so once again, this is the reason we're having this task force created. So all of these specific questions could be answered by the state. And quite frankly, I don't think we need to be led by the state. I think we should also be able to lead the conversation from a borough perspective as well, and from a local level as well. So that's the purpose. So we're gonna, I don't want to speak for the state because they have not been clear yet on what regulations are going to look like. And they're still coming up with those specific things. And actually they're on listening to, I thought, and I could be incorrect, but they did do, they are doing community meetings, listening sessions now on this issue as well. So they're taking that input, and I anticipate a report or something will be drafted with recommendations that we'll be able to either shape or share moving into the future. But, we're starting, this is one of the reasons I even want the community boards at the table as we shape our plan for Queens and what do we want to see coming out of Queens. And we should be submitting our recommendations to the state, and then going back and forth on them. And I'm not saying I'm going to be able to, dictate all the terms, but I think we can help to shape the regulations and conversation early on. So I don't think there's any other. Our
community board wants to be in the forefront of it as well, because I do believe Long Island City is targeted to have one or two already.
Of course. All righty. All right. Frank, you got one more, and then we're going to move on to DFTA. This has been an enlightening conversation.
Yes. Yeah, very enlightening. I'm glad we had this. This is just an FYI for everybody, including yourself, or maybe even Kat. In last week's AM Metro New York, there was a huge section on cannabis industry, the power players. There was a really interesting article, Seeing Green, Pot Profit, and the Promise of Justice. If you have nothing to do and you're interested in reading who the power brokers are, it's good reading, and it'll help you when you talk to your constituents or whatever. That's all I needed to say. Thanks for this. Very informative, by the way. Appreciate it.
Thank you. Wow, we've come a long way, because I don't think we could have even had this conversation 10 years ago. So it shows how far we've come, even as community board leaders and elected officials, because I could tell you when we started this conversation, people thought we were nuts. But then when you sort of looked at the injustice around it, it was real, and it was very telling, on what was happening when it came to marijuana in the city and state. So, all right, I want to thank you, Manai, for coming, and we look forward to seeing you back here seeing you in Queens more. But Queens Defenders has done a great job. We actually work with Queens Defenders also. We had created a youth court with them in Far Rockaway. And one of the ways we look to address some of these disparities that we're talking about, and Jonathan Gaskell was actually a part of that too, at the time of my inception as council member, some of these issues were popping up, and rather than putting these kids in jail, we were able to divert them at the time and work with the local police department and really change some young people's lives and direction. And that was thanks to really the Queens defenders, Jonathan and I, and people thought we were crazy when we wanted to do the youth court. I think I had put up like a lot of money to get it started out there. Yep. And it's really been a huge success. I don't know if Jonathan wants to touch on that, but a huge success. So thank you to Queens defenders.
Yeah, it really was. It was great. And it made the kids, because it really was kids mostly, feel part. I get that they were getting a fair shake and they were being judged by their peers. So it really was successful. And then it was defunded for a while, I remember, and we got very upset about that. So
yep,
it worked well. And I just want to say, for the record, I've never exhaled. So.
That's why you went off camera for a while.
That's right, exactly.
All righty, thank you.
I'll add to that I don't smoke anymore, but I don't smoke any less either. But on a serious note, I started the conversation thanking you guys for really inspiring children and working in government, and that's the most important thing you do. It's not passing laws; it's impacting these kids' lives. I'm starting to see it every day in criminal court. I have less kids coming in on these charges. So thank you for what you do. Continue to do it. And it was an absolute pleasure being here today. Thank you.
Thank you. All righty. We're now going to go into our last presentation. For our second presentation today, we're joined by Doreen Zong from New York City's Department of Aging. Doreen serves as DFTA liaison to elected officials, intergovernmental affairs, other agencies, community boards, and community partners. As many of you know, DFTA, the Department for the Asians' mission is to work to eliminate ageism and ensure the dignity and quality of life of New York City's diverse older adults. Doreen will present an overview of services for older adults throughout New York City. These services include supports for older adults as well as their caregivers through service, advocacy, and education. So we want to welcome you, Doreen.
Good morning, Borough President and everyone. Sorry, I had a tech problem and my computer was restarted, so I was going in and out. Sorry about that. So now I'm going to share my screen for my presentation. Okay, so many of you know that I'm the Queens Government Affairs Officer at the Department for the Aging. And today I'll be talking about community care options. The Department for the Aging has an array of community service that can help older adults remain in the community longer. So I'll be talking about some of these programs and services. It is important to be able to have this information and know what is there in order to support any older adults who wishes to remain safe in the community. So one of the most recent initiatives here at the department is the Community Care Plan, which basically what it is building a community care for an age-inclusive New York City. And it was released in April 2021 to expand aging support services. And among the key goals of this plan are the creation of innovative programs to meet the changing landscape of interest and the needs of an evolving and diversifying older population. As we know, the population of New York City, specifically the ones in Queens, is extremely diverse, and one size does not fit all. So it's very important that we know these programs and resources. So we hope that the development of collaborations between aging services and other neighborhood and citywide resources can achieve synergy that will benefit program and participants. This community care vision also includes an expansion of in-home care services. So here are the list of programs that we're going to be looking at today. I'm not going to read all of them, obviously, for the sake of time. And also, I want to focus on some of the popular topics that your constituent might want to know about. So we have a bill payer program, and basically what this program does is it connects older adults that are connected in the community with the department for aging case management programs for in need of financial assistance. And when I say financial assistance, I don't mean receiving funds, but financial planning and financial organization. Because sometimes it can be overwhelming to keep track of bills and making sure that they're paid on time. And so what this program does is it allows older adults to work with a service called the Silver Bills that has professional accountants that manage the bill and paying for the older adult. So making sure that important bills like rent and utilities are paid on time and on a consistent basis. So the requirement for an individual to have an income of no more than $60,000 a year, or for a couple no more than $100,000 a year, and that they're willing to have a checking account and they're willing to have somebody else to help them organize and make those payments via a financial technology platform that is designed by the system of Silver Bills, which is a wonderful way that they are able to track payments, and so people are able to see the summaries of what's being paid. Then we have the case management programs. In these services are offered for individuals that are 60 and older, and they are functionally impaired or they need assistance with at least one activity of daily living, such as bathing, dressing, cooking, and mobilization. They are primarily homebound and really go out perhaps for medical appointments. They provide a worker that conduct home assessment, and during COVID, this has been done virtual or telephonically. So these case managers help older adults to access benefits and entitlement, and really are the lifeline and the connection to help any type of support that the individual may need. And so under the case management program, think of case management as like an umbrella under there are couples of different branches, which one is home care, and this in-home services is for older adults. It's available for individuals who need light shopping or housekeeping or like personal care sometime during the week. And it's more for individuals that are not Medicaid eligible and can use some assistance at home. And in order to be eligible, there had to be a financial and home assessment conducted to determine the level of need in order to determine how much home care that individual would receive. So every case is assessed individually, but this is one of the services that can really benefit an older adult that are struggling to maintain housekeeping or want to continue, remain at home safely. So under case management, there is a friendly visiting program that what the program does is it matches older adults with volunteers that either do in-home visit or telephonically or on virtual visits. So during time of COVID, to reduce social isolation and also loneliness among older adults. And a lot of time, these volunteers become an extra set of eyes for the older adults. They see how they're coping and they're managing in the environment. And if they notice some sort of decline, they're able to then alert the friendly visiting coordinator and say, you know what, I'm concerned about Mr. or Mr. So-and-so. I was last week and I noticed that we talk on the phone and I noticed something, so it's a great program, and it creates a safety net for an older adult who's primary care homebound. And because of this, they may have reduced social isolation. And similar to the Friendly Visiting program, we also have a Friendly Voices program, which is basically connecting an older adult with a buddy for a phone visit or through virtual calls. Case management program also provide what we call the home delivery meal program. And these can be received once a day warm or twice a week frozen. So there's no cost for the home delivered meals. There's no financial eligibility. It's just for individuals who are 60 and over and have a nutritional meal need and are struggling to conduct their meal preparation. So they're able to receive home delivered meals. Many older adults have caregivers. And when I mean caregivers, I don't mean the formal ones. I don't mean the home health aide. I mean informal caregiver, which are family, friends, neighbor, or partner. And so the National Family Caregiver Support Program, we have 12 of those programs funded by the Department for the Aging, and they are the caregiver that fall under 4 categories. So individuals who are caring for somebody 60 years or older, or someone who is caring for someone with a dementia or Alzheimer's disease, and older adult that are caring for young children under 18, or older adult 55 or older, providing care for a disabled adult. And these programs provide a series of services, but most importantly is support that they provided that the family member who's trying to keep that older adult or disabled individual at home safely. They give them information, they assist with benefit and entitlement, they do counseling, they run support groups, and they offer trainings on financial planning and long-term care insurance on Medicaid, and undersees specific items and also other practical care issues. So sometimes the caregiver just want to know, for example, like my loved one has become bedbound or now become wheelchair bound, and how do I transfer them and how do I assist them without myself injuring? Or if I'm feeling overwhelmed, what is it that I can do and where do I start? And these programs are able to assist with that. So now we're going to talk about the 2 wonderful programs that we offer. And they are really there as a resource for older adult and caregiver. One of them is New York Connect, and it is a no wrong door initiative that provides information and assistance on long-term services and other types of information about community service in their area. They can call that 1-800 number and it will route it to their borough. So if they call this number and they tell them that they live in Queens, they will connect it to the Queens New York Connect hotline. And the next program is Aging Connect, which is almost like a stable item that I include in my normal district service cabinet meeting. It is a referral center at the Department for the Aging and is filled with aging specialists. And these specialists know the network of programs that are funded by the Department for the Aging, and they also know about some that are not funded by the Department for the Aging, but are available for all different communities throughout New York City. So if your constituents call our Aging Connect hotline, they can just call 212-AGING-NYC or simply 212-244-6469, and they will get an aging specialist that'll be able to walk them through the service system and be able to make the referral and make that linkage. And we also have a health insurance information counseling and assistance program, which is basically volunteers to help older adults to learn more about Medicare. Sometimes older adults are so confused when it comes to Medicare enrollment time. So like what plans do I choose? What plans cover my doctors? So the high cap, in short, of this program can assist with that, and they will have wonderful experts that can help the adult figure out what insurance to select and which Medicare plan will work best for them. And finally, we have the Elder Justice Unit, which includes in the DFTA's Elderly Victim Resource Center. And this is designed to protect older adults with disability from abuse, neglect, and exploitation. And so if an older adult becomes a victim of a crime, they can call to receive services and support and assistance. And so finally, I have included some additional resources that are always important to have. There are many individuals with different types of dementia or Alzheimer's disease, and there are organizations that are not necessarily funded by the Department for the Aging, but can be very useful for your constituents as well. And finally, we have the senior repair program or the home repair program. And sometimes these older adults, they need something repaired in the home. Sometimes they might just need a light bulb change. They might need a grab bar in store. So there are programs out there to assist with that. And so that's my presentation, and thank you again for inviting me.
Terrain, that was amazing. Go ahead. Sorry, Borough President, did you want to jump in?
I was saying you're going to take over this portion. Go ahead, DVP.
Okay, got it. I have an aging parent, so I think this is really critical to hear and understand what the options are. I'm going to open this up for questions, but I'd like to start off with Doreen, what are you seeing as far as digital competencies and navigating these systems? Are you finding that our senior population kind of shy away from even wanting to try? I know in working with my mother, specifically when she gets frustrated with trying to navigate, she tends to kind of give up and still suffers in the isolation piece of it. So could you give some feedback to that?
I think it really depends on the older adult, and some they are more adventurous and they want to try, and they want to learn and they're willing to learn, and some they're not so wanted to try and learn. And because I know in COVID time, many of the in-person activity has moved to virtual, or they start to learn. They might learn how to navigate, how to go online, how to connect with people, how to use Zoom. And they become the expert actually because they're using that every day. So that's what I see, and that's what I hear. And some, older adults actually share that they're very happy. They're actually learning on these new technology. They can use it with their grandchildren, grandkids. They can connect with, the kids from around the world. They can connect with their friends, and maybe they join Facebook and they find like their childhood friends that they haven't met for years. So I feel like it's good that our aging population is using technology now.
Absolutely. Our 2-year-olds are teaching us. Yeah, so are there any questions around this topic? See any raised hands? Okay. BP, do you want to jump back in? And oh yes, sorry, I see a raised hand here. Giordano.
That's me, thank you.
Mm-hmm.
If we could get a copy of this, Doreen, I'd appreciate it.
Definitely, I will share it to all of you since I have all your email addresses.
Yeah, I usually take pretty good notes, but since I'm eligible to go to the Senior Citizen Center, I'm not as quick as I used to be.
All good. Florence, you have your hand raised.
Hi, yes, I know during the pandemic, DFTA did ask for us to support funding for, I guess, not laptops, the tablets. They had asked for funding towards tablets. Now that people are going to start being able to go regularly back to the senior centers, is DFTA creating a permanent program that will help the seniors learn how to use tablets? And are you still looking for funding for tablets so that this can be expanded? It seemed like a very sensible project.
Thank you, Florence, for bringing this up, and we appreciate your advocacy in this. Actually, DFTA is actually having a tablet distribution program in the 3 neighborhoods, and we also work with other organizations to provide trainings or tech support for older adults that need help with how to navigate, how to go online, how to use Zoom, or how to use applications. So I can share that with you, after the meeting. I can, write up an email and include that in the resource as well.
Great. Any more questions? Want to keep the floor open? I don't see any hands raised here. Okay, I think we're coming to the end of our presentations here. And
my
yes.
apologies. One thing, Doreen, you said in certain neighborhoods. Do you know which neighborhoods that they have the tablet distribution?
In the 3 neighborhood.
Okay, thank you.
I'm going to sound lame. What is a tree neighborhood?
Doreen, are you speaking? You're on mute.
She may have gotten kicked off with technology.
Yeah, no
Don't
worries.
see her.
Okay, yeah, absolutely. Okay, are there any more questions? We'll make sure we get back to you, Florence, on that answer. Any more questions? If not, it looks like we've come to the end of our time together. We appreciate you all. Thank you so much for joining us. And as always, be well, be well.
Thank you.
Thank you, guys.
I'm sorry, I
Madam-
actually just came back. I'm sorry.
Oh, okay,
Technology is
Doreen.
really not by my side today. So
No
I'm sorry.
worries.
The TREE program actually stands for the Task Force for Racial Inclusion and Equity. And I can share that with you after the presentation as well.
All righty. Thank you so much, Doreen. Appreciate your time.